Hi, I'm Dr. Surekha Tiwari. I'm a practicing homeopath and a psychological counselor. I have my clinic in Bangalore and I have my patients all over the world. I am in this profession for the last 32 years and I'm based out of Bangalore for the last 22 years. Urinary tract infections in old age males, generally because of enlarged prostate. There's a condition which is known as BHP, benign hyperplasia of the prostate, which causes the prostate to get enlarged, which is in the root of the urinary expulsion. The prostate enlarges and causes urine to get stagnated in the bladder, which can get repeatedly infected. In females, I have generally seen UTI happening because they have a condition which is known as PID, pelvic inflammatory disorders, in which case that is basically because as a woman attains menopause, the uterus tends to become bulky, and more bulky the uterus, the bladder also starts underperforming. There is stagnation of urine in the bladder and it causes repeated infections. Also in women, the other condition which can cause urinary tract infections is any kind of leukorrhea. If they have white discharge problems, they can have very frequent UTIs. So now the first line of treatment, the men need to treat their prostate. BHP has to be treated. In homeopathy, there are very successful medicines for BHP and they can be taken very effectively. For women too, the same logic. They need to deal with their PID. They need to deal with their white discharge for the UTI to become better. Now, having said both of these, three things I will tell you which will work very nicely for anybody who's got recurrent UTI. First, black tea with lemon. If you can brew some black tea with a few drops of lemon and even black tea brewed with a little mint leaves. If you can have 2 or 3 such cups in the day, A, it makes sure that the bladder pH remains good enough, does not fester bacteria. B, it also flushes out the urine. Once the urine is flushed out, you'll feel better. The second, don't hold urine. I can't go right now because the toilet is not clean. I can't go out because I need to go to the toilet at home and all those things. The more you will hold your urine, the more the bacteria will find the opportunity to multiply. And the third thing, before going to bed, make sure that you have the least water so that there is no stagnation at night. So before going to bed, at least 3 hours before going to bed, start just sipping water. Don't drink and gulp water. And before you go to bed, try and go to the toilet twice so that you're emptied your bladder. Once the bladder is emptied, the stagnation does not take place at night. Automatically, you'll get up thirsty in the morning. Go ahead and have lots of water during your waking hours, which will clear off your bladder. Should take care of UTI with these measures, but whatever is left, please go to a nearest homeopath. You will find immense relief, as also there will be relief in the primary cause. So, well worth a try.